Okay. All right. Hi, my name is Justin Day, and I'll be demonstrating how to withdraw medication from a vial and how to administer a sub-Q injection as well. And so let's go ahead and begin. So I'll go ahead and check my 5 rights when it comes to getting the medication. Sorry, 7 rights, not 5 rights, just to make sure that we're doing everything right. So at this point, let's go ahead and begin. We have our materials here. I'll begin with my hand hygiene. So normally I probably just wash my hands and then get ready here. So in this particular case, we have a bottle of heparin is actually what it is. So what I'll just go ahead and do, normally this is with insulins, but I'll just go ahead and flip it over and roll it in my fingers. Let's go ahead and get that stuff mixed up properly. And we'll wipe off the top of this vial. It says a little rubber stopper on the top. We'll wipe that off, get that clean with some alcohol. Now, the thing with drawing medication from vial is that we need to get positive air pressure inside this vial so that it will go correctly into the syringe. And there's a way that we do that. So let's say that I wanted to get, I had to draw 20 cc's. What I would do is draw the plunger back to 20. Okay. Now I'll go ahead and put that needle in. And what I do is I push actually that air into the vial. And what that's going to do is create a positive air pressure so that way that medicine should flow easily back into the syringe. Now I wanted to get 20, right? So I'll pull it back, the plunger. Now I'm at 20. But I might want to go a little bit beyond that, say like 25, just so that way, you'll see why in a second, if I have any air bubbles or whatnot, I can push that medication back in there. And then, so you tip it a little bit, there might be some air bubbles, and now we'll push that back to 20. And all those air bubbles should go back into the vial. And pull it out. Now, we need to find a way to get this medication to the client's room. We don't want to be running around a hallway with a sharp needle. So we're going to go ahead and cap this needle on the syringe. Best way and easiest way to do that is use the scoop method. We just put the cap down, flat, top of the surface. Then we'll go ahead and scoop that needle into the cap. Nice and safe. And from there, we'll go in the patient's room. Okay, folks. Now, after we have drawn our medication into the syringe, we're going back into the patient's room. Go ahead and practice our hand hygiene, adhere to the principles aided, and then also make sure we assess or check the 7 rights of medication. We'll also ask the patient if they have any hypersensitivities to the medication that's going to be given. We don't want any odd allergic reactions that could possibly happen. So, at that point, we've already practiced our hand hygiene. Glove up. 1 glove. 2 gloves. And we're going to get ready to do what we came here to do. So we'll look at the abdominal area that we're going to give our sub-Q injection into. And we'll go ahead and assess for any scarring, bruises, rashes, those kind of things. We want to avoid those areas. We don't want to cause any extra damage that could be to the skin in that area. We also want to be around a 1 inch or 2 inch, a further circumference around the belly button area. We don't want to be giving any medications into the belly button. It would be a bad day right there. And once we've done that, we'll go ahead and take our alcohol pad. And we want to clean the area that we're going to be injecting in, or the side that we'll be injecting the medication in. So usually a circular motion, in, out. Yeah. Okay. So go ahead and grab about a 1 inch fold of the skin. Okay. Now we'll hold the syringe like a dart, and we'll go in either a 45 or a 90-degree angle. If you have a larger patient that has a larger fold of skin, you probably want to go in the 90-degree angle. Otherwise, it's around 1 inch. We're going to go in 45. Ask the patient to breathe out. Breathe out. Put it in. And we'll go ahead and slowly push the medication in. Once we've done that, pull out, flip the syringe, engage safety, dispose of the syringe in the sharps container. If there's any bleeding after you've given the injection, you can go ahead and give the patient a Band-Aid. And at that point, thank the patient very much for their time, and that we'll be seeing them again soon, and we can finish with the rest of our cleanup. And other than that, that's it. Thank you very much for watching. Let's wrap.